Thanks so much for staying with us here in the Big Show. A massive move by Apple is going to allow you to limit your screen time, ladies and gentlemen, and how much time your children spend on their apps. It's part of a new update heading to iPhones later this year. They're calling it digital well-being. Dr. Linda Cox from Tulane University is right here right now to talk about how social media can actually affect your mental health. Dr. Cox, we appreciate you being with us today.
Well, thank you for having me.
I think a lot of folks were shocked just from a business corporate point of view that Apple would come out with a game plan and a strategy that would actually limit people's time on their phones. But it is a problem, I think, in America today.
It is.
What do you think?
It's a problem, and what we're finding is that people check their phones at a minimum 85 times a day, and a lot of people check it more compulsively than that. And it ends up being a time waster. It ends up being a distractor, a way to alleviate boredom.
Well, I think even worse than that, it's killing social interaction. I feel like a dinosaur because I'm not really into the phone that much. But I'll go to a meeting somewhere and I look in the room and everyone is sitting there on their phones.
Texting each other.
Talking.
Texting each other on their phones.
Yeah, they're
sometimes.
sitting in one room texting each other.
I've seen both my daughters sit in a room and text each other.
And then you go to a restaurant and you see a family sitting there looking, they're looking at Facebook or Instagram or Snapchat.
And so it hurts our ability to be really connected with one another. It's like a pseudo-intimacy, and it's not healthy for us ultimately.
And, you know, adults, like everything else, when it comes to behavior, you have to, I think, look at it from an adult perspective, an adolescent perspective, because the impacts are different, and we have to worry about this next generation, I think.
We do.
That are coming up that are literally, in my opinion, this is their umbilical cord. They're addicted to this thing.
They are, and it can really get in the way of relationships. It can make a bad impression on the boss in a business meeting if you're scrolling on your phone instead of paying attention.
And what about when you add the social media component, how people can, with one tweet, get in trouble, as we've seen lately in the news, or what you do on your social media if you go apply for a job or maybe try to get into a university, they can follow sort of your trail.
Oh, they can, and it can hurt you in the interview process. It can hurt you if you're standing in an organization or a community. It can get you into interpersonal difficulties if you're injudicious in what you put out there on a social app. So
what advice do you have, because we're almost out of time, in terms of weaning oneself off of this thing, of kind of behavioral modification?
Well, some of the things you can do is try to schedule how often a day you check your phone. You can even put a timer on your phone about how often you're going to check it. Try not to check it several times an hour. Try to check it maybe once an hour, and then go to twice every 2 hours maybe, or every 3 hours. Don't plug it in next to your bed at night. Plug it in somewhere else and use your alarm clock to get up. Turn off your notifications. Maybe change the color of your filter, your feed, so it's not so attractive.
Well, that's all great advice. I'd like to get together with you down the road and maybe we can talk more about this, because I think this is a present and future issue that deserves more exploration. Thanks for being with us.
Thank you so much.
From Tulane University, Dr. Linda Cox. Well, it's a whole new world.